Hello everyone, I want to give you some information about the BBL. Today we have a patient, our patient is coming from France, and we will do the liposuction and the BBL for that patient. And now we're planning to applying the two techniques for this patient. First of all, we will apply the laser, and we use the laser for melting the fat. Laser is ultrasonic like a device, and we use this laser for melting the fat. And after that, we will aspirate the fat with the micro air. And after that, we will separate the fluids and the blood part of this fat, and we will get the pure fat. And after that, we will inject this fat to patient's hip regions and the butt regions. And in this patient, we will prefer the use of in that patient, we will use the safe BBL techniques. And also during the operation, I try to explain what is the safe BBL and which device we use in that case. I will show everything step by step. Hello again. Now we will start our surgery. We can do this operation under general anesthesia because we will work in the abdominal region, flanks, upper and the lower back sides. And for starting the surgery, first of all, we infiltrate the fluid from the operation field. This fluid contains adrenaline, and we use this fluid to decrease the bleeding. And after that, we wait around 10 minutes. And after that, we start the laser. We use the laser for melting the fat. The laser gives ultrasonic waves, and it's caused the melting of this fat. I want to show the effect of the laser now in the water. You can see this. It gives the ultrasonic energy, and this device works in the like a fluid space. And this device working the wet plate, and it causes the harm to the fat cells, and this harm causes melting the fat. And after that, we aspirate the fat, this melted fat, with the micro air. Now I will apply the laser, and we will give the ultrasonic energy to the fat cell, and we will try to melt the fat. We generally apply the laser 10 minutes for every field of the operation area. For example, we will do the abdominal region, we will do the flanks for that case, and so we should apply the 20 minutes for the flanks region and 10 minutes for the abdominal area. And after we melt the fat, and we use the micro air for the aspiration. Now we finished the application of the laser, and we melted fat, and we will aspirate the fat with micro air. Micro air is the power assisted system, and it causes this kind of vibration. And with this two combinations, so laser and micro air combination, our aim is getting the smooth, like a loose weight appearance on the operation field. And now I will aspirate the fat with the micro air. I will collect the fat in this place, and after that we will separate the fat and the blood and the fluid. And after that we will get a pure fat, and we will inject this pure fat to the hip and the butt region of the patients. And first of all, I should aspirate the fat with micro air. Now, first of all, we aspirate the fat from the abdominal region, from the flank side, and we collect the fat in this tube. And after that, we remove the blood and the fluid from the fat, and we have a pure fat now. Now, I will inject the fat for the hip region, and we want to increase the hip size slightly. For this, we will open the one hole, and after that, we will inject the fat to the hip area to increase the hip size. I open one hole for this region, and after that I enlarge the hole. And generally for fat injection, I prefer the power assisted system. Now we finish front side. We aspirate the fat from the abdomen, flanks, and we inject the fat for the hip regions. Now we will turn the patient. We will aspirate the fat from the back side to decrease the belt size. And after that, we will inject the fat to the butt region. We will increase the butt area, and we will finish our surgery. Hello again, I want to give you a brief information about the safe BBL. In this technique, now we aspirate the fat whole this area and we start to inject the fat to the butt region. In the safe BBL, we inject the fat between the muscle and the skin region. We don't inject the fat inside the muscle area because there is a wide arteries and veins. We don't want to get any kind of embolism risk. We don't want to see any kind of embolism problem. Because of this, we apply the safe BBL. And in safe BBL techniques, we use the ultrasonic device and we check the exact plane that we inject the fat, and we want to see the exact plane for the fat injection. You can see this area and which part of the space we inject the fat, and I want to show you also this. We also inject the fat with the power assisted system, and you can see the space. And now I will inject the fat, and this place I fill this area. And when we use this ultrasonic device, we know that we don't inject the fat inside the muscle. Only fat injection is done between the skin and the muscle area. That means the safe BBL. Now we finish our surgery. It lasts around 4.5 hours, and we inserted 2 drains for the patient's abdominal region, 2 drains for the back regions. We use these drains. Drains are the silicone tubes, and we use these drains for removing the blood and the fluid from the operation field. And we injected the 600 cc fat for the one side of the hip and the butt, and 600 cc for the other sides. And now the patient will wear her corset. And after that, we will transfer this patient to her rooms, and she should stay 2 nights at hospital. During this period, we will give very strong painkillers and antibiotics to prevent any kind of pain and infection. And 4 hours after finishing the operation, she should start to eat something, and after that, our nurse will help our patient and she should start the walking. And during these 2 days, we will give her painkillers, and she should learn the movements and she should learn the walk. And if everything is okay, 2 days after the surgery, we can transfer our patients. And after this kind of surgery, after BBL surgery, the patient should stay in Istanbul minimum 7 days. And after the surgery, I want to check the patient minimum 3 times. 2 or 3 days after the operation, I want to check the patient again. And 4 or 5 days after the surgery, I generally remove the drains. 2 days after removing the drains, the patient can start to take a shower. And we don't want to apply the pressure on the butt region, and we should protect the butt area to protect the fat injection. And the patient should lay down on her face for 3 weeks after the surgery. And also she should use the BBL and also she should protect her fat injection during the sitting position and the sleeping position. And 3 weeks later, she can start walking type exercise, but she should wait minimum 6 weeks for regular workout. And after the surgery, after the BBL surgery, the patients cannot do the squat type exercise for 8 weeks because we don't want to apply any pressure on the butt region. And we finish our operation, we get a good result. And after the surgery, she will get a lymphatic treatment. This treatment should be applied minimum 10 sessions. Every 2 or 3 days she can get this treatment. And after that, she can get a good appearance in her abdominal and butt region.